1.
Hi, Joe.
Hi.
I'm Annie. I'm a level 1 student nurse. I was wondering if I could shadow you today.
Absolutely, Annie.
Okay. And I understand you're going to see a patient here in just a few minutes?
Yeah, I'm going to be seeing Mr. Ryder Kine.
Okay. Can I get an SBART report on that patient?
Sure. Let's see now. This is room 620. It's Mr. Ryder Kine. His physician is Dr. Phillips. He is a 67-year-old male, 5'11", 171 pounds. That gives him a BMI of 23.9. He is currently a full code with no known allergies. He is a medium fall risk, and he's at risk for pressure ulcers. He was admitted with a chief complaint of a stage 2 diabetic ulcer on his right heel. He has diabetes mellitus type 1 for the past 20 years. So he'll be getting regular insulin today, which obviously has an onset of 30 to 60 minutes, a peak of 2 to 4 hours, and a duration of 5 to 7 hours.
All right.
He does have a peripheral IV in his right median vein, so that's in his forearm. Let's see, his last glucose reading was 290, so that's kind of high.
That is high.
We're going to take that down. He had a pain assessment done just a little while ago, and it was a pain level of 1. We're going to check that when we go in there, make sure that's still the same. His last set of vitals, he was 98.4 degrees Fahrenheit. His pulse was 76. Respirations were 16. His blood pressure was 128 over 70, and he was 96% oxygen saturation on room air.
Okay.
We're also going to do a little bit of a dietary training with him for his low sodium diet. Again, his chief complaint was the diabetic ulcer. He's been in the 120 ranges as far as glucose until about 3 weeks ago when it started to climb up, and he's been in the 300s since then. So we're going to take care of that for him. As far as past medical history, he's denying any contagious diseases. He denies any tobacco use. He only drinks 1 can of beer a day when he goes bowling 1 can of beer a week when he goes bowling on Friday. He denies any trauma or illness. He denies any cardiovascular or respiratory problems. No head, ear, eyes, nose, throat problems. He currently has 20/20 vision, which is pretty good. He's also denying any musculoskeletal, neurologic, or lymphatic problems. So we're just going to be treating him for his diabetes mellitus, and then again checking his heel.
Okay. Now, why specifically is this client receiving this medication?
Again, it's because he's type 1 diabetic. His body can't produce the insulin he needs to control his good glucose levels.
Okay. And what action does the medication have on the body?
The insulin helps facilitate the uptake of glucose into the skeletal muscle and the fatty tissue. It also restricts the hepatic production of glucose.
All right. When should you question administering this medication?
You're going to question giving the medication if the client's showing signs of hypoglycemia. They're anxious, shaky, cold and clammy, have heart palpitations. You're definitely going to want to hold it.
Does this medication have a therapeutic serum level?
No, there's no therapeutic serum level. Excuse me, tongue-tied this morning.
That's fine. Now, what vital signs would you want to monitor?
Again, you're going to want to monitor all vital signs because you're going to check for those that signs of hypokalemia. So it would be temperature, it could be heart. So you're going to want to monitor all vital signs, and you're also going to want to monitor the glucose level to make sure that the glucose to make sure the insulin is trending him in the right direction.
Okay, that kind of answers my next question, but which physiological parameters should be monitored when the medication is being administered?
Again, it's all the things we just talked about. So it's, what's his temperature? Is he cold and clammy? Is he having heart palpitations? Is he anxious? His level of consciousness? All those are signs of hypokalemia that you really want to watch out for.
Okay. Now, what interventions should be taught to ensure that the client's being administered the medication safely in a hospital setting?
In the hospital setting, you want to educate the client when they come in to make sure that they know the correct medications that they're taking, that they know what it looks like, they know the proper route and administration process so that they can be the final check to make sure that there are no medicational errors, that they are receiving the right medication, the right route, the right time, the right dose.
Okay. And what about at home? What interventions would you teach to make sure that they're taking the medication safely at home?
Again, it's similar. You definitely want them to know what the medication looks like, how to administer the medication, how to store the medication, and what signs to look out for that are contraindicating administering the medication. So it's like signs of hypokalemia. You want them to know the signs of hypokalemia so they won't administer insulin if they're showing signs.
Okay. And what are the side effects and potential adverse reactions of the medication?
I hate to keep going back to it, but hypokalemia is the #1 adverse reaction.
Okay. And then how will you know that the medication's effective?
We're going to know the medication is effective by checking his glucose levels and seeing his, checking his glucose levels, and they should be trending down to a normal baseline for this patient. So for him, his normal baseline was in the 120, so we want to get that back there.
Okay. Well, those are all the questions that I have for now.
All right, well, let's go in and see Mr. Ryder Kine.
Hello?
Hello, Mr. Kine, we've got some medication for you. Can we come in and deliver it?
Yeah, of course.
I've got student nurse Annie with me today. Is it all right
Hi
if
there.
she watches?
Yeah, sure.
How are you doing today?
I'm doing all right. How are you?
Pretty good. How's that heel doing?
It's doing all right. It's the morphine helped a lot. So.
Okay, so what would you rate your pain then on a scale of 0 to 10?
I think it's still a 1, but
A
I feel
1?
like it's getting better, so it's probably
Okay.
going to be a 0 in about a couple more minutes.
Good, good. And your last glucose check was 290, so we're going to be
Oh.
giving you insulin today.
Yeah,
on a
that's
sliding
kind of
scale.
high.
And let's just check the medications here. Let's see. Okay, so you're on a sliding scale. And you had 290, so we're going to be administering 16 units of regular insulin for you today.
Okay.
And you don't have any allergies, correct?
No, I don't.
And where was the last place that you had insulin administered?
I think that was on my left side.
Left side? Okay.
Yeah.
So has anybody told you that you should be doing rotating your insulin injection sites to prevent lipodystrophy?
Yes, kind of. Like, I know I'm supposed to be changing sites, like, once a week or so. But is it okay if I just give it in the same spot?
No, you don't want to give it in the same spot because that's what happens is you get lipodystrophy, which is a buildup of scar tissue
Okay.
and the fatty acid, and it prevents the uptake of the insulin the way it should be. Can you give me your full name and your age?
I'm Ryder Kind, and I'm 67.
And again, do you have any allergies?
Nope,
Okay.
not that I'm aware of.
That sounds awesome. And I pulled the medication already from the drawer. And I'm just going to triple check here and make
Okay.
sure this is correct, and it is. So I'm now going to scan the medication. And it shows up green that it's now going to be given.
Okay.
Just going to document the time. And you said you got it on the left abdomen?
Last time, yeah.
Okay, so we're going to be doing Okay. And you're going to clean the top of the vial.
Okay. I've heard clean it like you mean it.
Yep, that one's been around for quite a while. So if that's what helps, absolutely use that.
Should I be doing that at home too with my insulin?
In the home setting, you don't want to use alcohol wipes. What you want to do is use soap and water.
Okay.
What happens is the alcohol, and I'm going to be giving it right here. I'm just going to
Okay.
pinch a little bit, and then I'm going to clean. The alcohol lyses the blood. So in the hospital setting, we do it because we know to get rid of the first little bit of blood. But at home, you want to just use regular soap and water. So we're going to draw up 16. I'm going to pull more air than I need. And we're going to inject the air into the tube. And again, we're going to pull back more than you need so that if you get an air bubble, you can push it back into the vial.
All right.
So I'm going to draw somewhere in there close to 18 or 20 minutes. Give it a couple flicks. And then I'm going to push. There's a little air bubble. Got a big old
Tricky
air
little
bubble.
sucker.
Yep, let's do that again. There we go. 16 units.
Perfect.
All right. So now you're definitely going to use the one-handed cap retrieval method. I use the glove box to make sure that it doesn't slide on me.
And that's just so you don't stick yourself with the needle, right?
Correct. Safety first. And I'm just going to clean you again because it took me a while to get that insulin drawn up correctly.
I also licked my hand and rubbed my stomach, so.
Well,
kinda-
you know, that's something you don't want to do, especially in the home setting, because there's nobody there to double check you. Okay, and now I don't like to pinch to make sure that they've got a correct amount of adipose tissue there,
Okay.
so I'm going to go straight in. So do it like a lance, you stick it right in, and you're going to inject, and you're going to hold it for 5 seconds.
Okay.
Then you pull it out, throw it straight in the sharps container, and I've already documented that it was given. Did that feel okay? Didn't hurt you ever at all?
Not really, no. Just
Okay.
a little prick.
Okay. Now, I know we were talking earlier about your diet. I've got some printouts for you. I've got a meal planning guide
Ooh.
that actually has a chart on the back page that you can fill out to help you document what you're going to plan to eat.
That's cool.
And here is an actual filled out chart on an 1,800 calorie diet, diabetic diet, so that'll help you. And then for your foot care, to help you take care of your feet, prevent any more diabetic ulcers, I've got that. And you want to see a podiatrist, really. They should be looking at your feet, clipping your toenails to help prevent infection.
Okay.
All right?
I'll keep that in mind.
Do you have any questions for me?
Nope, that's it, I think.
Okay. And I'll be back in a little bit. I'm going to check your glucose.
Okay.
And I know, I think you've got a tray of food coming here, so
I do.
make sure you eat. That's very important. All right. I will check on you a little bit in about an hour.
Sounds good.
Have
Thank
a
you
good
for
one.
your time.
Thank you.
Okay, I do have a couple more questions for you.
Well, sure.
Now, were there any pertinent pieces of information that you reviewed before administering the medication to this client?
Yes. The pertinent pieces of information were I double-checked to make sure that the client had no allergies.
Okay.
I checked to make sure that it was the correct patient, obviously. I I was talking to the patient and assessing to make sure that there were no signs of hypoglycemia. You saw I touched the patient. I talked to the patient to make sure the level of consciousness was there. I double-checked the glucose to make sure that they were getting the right amount of insulin. And I asked the client where their last insulin injection was so that I could rotate to another site.
Why is all of that important?
It's all important because you want to make sure that you're giving the correct amount of insulin to the patient. You definitely want to make sure you're giving it at a different site to prevent lipodystrophy.
Okay.
And it's very important to check to make sure that there are no signs of hypoglycemia, because that could be very bad if you give insulin in a hypoglycemic state.
Okay. Now, did this information affect your decision to administer the medication?
Well, it just confirmed that the patient did need it on the signs that I saw, that it was okay to go ahead and give the insulin.
All right. And did this information affect how you administered the medication?
Other than rotating the site, no, there was no change in how I gave it. Just making sure that, you rotate the site and you're not giving it in the same spot over and over again.
Okay. Well, those are all the questions that I have for you. I really appreciate you letting me shadow you today, Joe.
Not a problem. Anytime, Annie. Good
All
luck
right.
in school.
Thank you so much.
You're welcome.